So this is going to be part 3 of my BRCA1 positive and preventative mastectomy story. So a very quick recap of parts 1 and 2. I was given a BRCA1 positive diagnosis about 2.5 years ago in 2018, and then I had a double mastectomy preventative February 19th, 2020. So part 3 is going to be the days right after my surgery up to about 6 weeks post-surgery, sort of what I experienced, any tips or tricks that I learned, and just kind of what to expect. So surgery happened on a Friday, and I was back home that next Saturday, so I spent the night at the hospital, and I did not really take pain medication, so I talked in part 2 about what they did for my sedation. They actually did a nerve block in my chest, so I really didn't have any feeling for about, I would say maybe 36 to 48 hours post-surgery. They did give me 1 dose of oxycodone the night after my surgery because I was having trouble sleeping. But other than that, they gave me a prescription for oxycodone and Valium, and I have a full bottle of oxycodone downstairs because I just didn't feel like I needed it. What I did do for pain management was every 3 hours I would take 400 milligrams of alternating Advil and Tylenol. So pretty low dose, but taking it overlapping like that really helped to keep the swelling down, kept my pain quite manageable. The only time that I did have pain was actually when they were filling, and for about a day to maybe 2 days post expander fill. So I had the surgery to remove all of my tissue. I had 350 cc empty expanders placed under my pectoral muscle, and then the first fill that I had was 4 days post-surgery, and they put 50 cc's in. So I went in for then, after that first fill of my expanders, I went in once a week, and they put either 50 or 75 cc's of saline into my expanders. So what they do for that is the expander, it's probably about this big, really oddly shaped, hard, lumpy, uncomfortable, ugly. You see it underneath. So when they first send you home, you are like flat chested but with saggy skin. It's not cool to look at. For me, they actually glued my incisions and then put tape over them. I did not have a lot of swelling. I did not have hardly any bruising. I think I got really lucky in that, just hearing other people's stories and what other people have gone through. I'm young and I'm healthy, so that could be a big part of why that process was easier for me. So the main annoyance right after surgery is actually going to be the drains. They put 1 drain on each side, kind of underneath your breast, and it basically pulls out any fluid buildup underneath the empty chest cavity. So the first day or 2, I don't think I had that much fluid draining, but the first fill like tripled the amount of fluid, probably just because there was more pressure in my chest cavity and a lot more movement. I was moving around more. The more you move, the more the drains are going to fill up. They're gross, they're uncomfortable, they're the worst part, in my opinion, about the whole process was stupid drains. I mentioned in my last video that I did not buy any specific articles of clothing to deal with the drains. I just wore like a button-down nightshirt that then I safety pinned the drains into either side. Once I could get to a point where I could get like a tank top over my head, I just pinned those suckers right to my tank top, and you sleep with them on, you shower with them on. I was able to shower 48 hours post-surgery, which was great because I smelled horrible, I felt horrible. Showering really kind of just makes you feel like I'm a person again. So the drains were gross. I will see if we have photos of those. I think Marcus may have taken a couple of photos, and we'll insert them just to kind of give you an idea of what they look like. They do suture the drains right into your skin so that you don't pull them out accidentally. So if you do tug on them, it's not pleasant. And the drains themselves, they actually expect you to keep a log. So every day you have to have less than, I think it was like, if I had less than 10 mils for 2 readings and you read twice a day, I could call the nurse line and they would make an appointment as soon as possible to get those pulled out. The drains themselves kind of snake in your chest cavity, and when they pull them out, I'd read that some people thought it was like the grossest thing ever. I didn't feel it. I had a great nurse, so she basically just yanked that sucker out of there, and they did them both at the same time. So I had two nurses, one on each side when they pulled the drains out, and they just right out at the same time, and we were done. And it's kind of a gross feeling, but you feel 10 times better leaving the clinic once those are out. It's just, you're kind of able to move around again. You don't have the uncomfortable hanging. You don't have to deal with the suction feeling in your chest. They're the worst part, in all honesty. I think I had my drains for about 10 days. So just keep that in mind. I think I was a bit more active than I probably should have been, so that could have contributed to why it took so long for me to get down below the 10 milliliter per emptying session. I definitely would have someone else help you with that, someone you trust. It made me queasy whenever Marcus would strip the drains, because there's like a suction feeling in your chest that just didn't feel right. So medication. So as I mentioned, I really didn't take much for pain medication other than over the counter. The thing that I did end up doing was Valium. I think I took Valium 4 times, and it was all either the 2 days post-surgery when I got home, and I was just, it's like if you sit and you don't move, you almost don't feel it. So you're kind of like, okay, if I just sit in the chair and I don't move, I don't really feel the discomfort. But moving around the first couple days was hard, so I did take Valium then. I did get muscle spasms in my pectorals, and the muscle spasming also happened post-fill. So when I would go in once a week to get my expander filled, I would have muscle spasming up here in the pectoral muscles, and that was painful. I cried once the whole time. The entire process, I only cried once, and it was like my second to last fill. I think they put 75 cc's in, and I laid down in the bed and I just started bawling because it hurt so bad. But once you give it like 2 minutes, the muscles kind of stop spasming, and it was fine. So in general, I think I'm really shocked at how easy I found this. Everybody is different. Every body is going to react differently to this. You know, everyone's situation is going to have its own quirks, but I didn't think this was as bad by far as what I was expecting, given what other people were telling me to expect. I personally don't know anyone in my everyday life who's done this surgery the same as I have, so it's hard for me to really know, other than other people's horror stories on the internet, what I should have expected. And I think I set myself up for expecting worse, which is good. I mean, I would rather not expect it to go fine and then have a horrible time, but I really think for me it went well. As I mentioned before, I did not have major bruising or swelling or anything like that, and I'm really grateful for that. I think it made the process much more tolerable and positive for me. Motion and activity. So before they released me from the hospital, I did have to meet with a physical therapist, and he did give me a packet that kind of outlined the different motions that they want you to do every day. So it's kind of like shoulder rolls, lifting your arms up, and just kind of pushing yourself, but not pushing yourself. I think that's really important to know where the pain boundary is, and I think because I didn't take any pain medications, I was acutely aware all the time of how my body felt. And I pushed it, but I didn't push it to the point of pain. Discomfort? Yes, I pushed it to the point of discomfort, but not to the point of pain. So I actually started doing easy yoga. So child's pose, this tree pose where you just kind of stand there with good posture. That was a big thing, was when you have the expanders and they kind of pull you forward because you're stretching out your pectoral muscles. So you really have to focus on sitting back. And I feel like, being able to stretch my arm, I actually just had my expanders removed and my implants put in 3 days ago. And you can see I'm basically almost back to full range of motion, which is great. I would really recommend that if you can, if it's something that you are able to do pre-surgery, spend a lot of time stretching, get into yoga. I think that has helped me with my recovery more than anything. Just getting my body used to stretching and being loose in your muscles, being healthy before the surgery is going to do so much for you in the recovery stage. At least that's what helped me the most, I think. Maybe I'm just making that up. Maybe it's placebo, but I'll take it. So the last part of the post-surgical experience that I want to talk about is my scars. So I'm not going to actually show them because I don't know if that's allowed on YouTube. But I had seen so many photos on the internet of people having these massive scars across both breasts that were like train tracks where they had staples or stitches. My team used glue and tape, and I'm gonna be honest, they look great. They look amazing. My plastic surgeon actually looked at my scars for my pre-op appointment before my exchange surgery, and she was also surprised. I've taken really good care of the scars, and it wasn't as bad as I expected. So maybe that's, again, just a me thing. Some things to think about. It's not going to be pretty. Your chest is not going to be pretty, but that's okay. If you come home and take off your shirt and look at yourself, it's going to be ugly. It's definitely not going to be perfect. And I now have my implants in, and they're not perfect. It takes months for everything to kind of fall into place, for the swelling to go down. I do have some minor bruising right now, but it takes time for your body to readjust to all of this. And don't judge the process too quickly. That would be a big piece of advice, is that your body's been through a lot, and remember why you're doing this. That's been key, I think, to my mental understanding of all of this, is that I'm doing this now so that I don't have to deal with it with a cancer diagnosis at the same time. So I wanted to have the mastectomy before I needed it, because there was a pretty high chance of me eventually needing it. So scars, you will have drain scars. They're like tiny little holes that seal themselves. And the breast scars themselves, I would say they're about 6 inches long on me, but if I wear like a triangle bikini top, it actually covers them completely, which is great. And other things for scars, don't get them out in the sun for at least a year, so no topless sunbathing right away. I don't know if this helped realistically or if it's just in my head, but I have pretty sensitive skin on my face, so face products break me out really easy, and I did have kind of a hoard of random face products that I wasn't going to use on my face, but I didn't want to get rid of either. And I started putting those on my breast tissue once the scars were kind of able to take that. And I don't know if that helped or not. I like to think that it did. Could just be my age and how I heal, but keeping them like taking care of them is really important. So if you have nice lotion or serum or anything like that you can put on them, it's not going to hurt. If anything, it's going to help. And then lastly, with the post-surgery, one thing that I just wanted to talk about was mental health. For me, I have a very good family support system. So if I was ever having a down day, I could call my mom. If I wasn't feeling well or anything like that, I could talk to my husband. I'm very lucky in that I have a very strong support system who are willing to talk about this. My best friend has checked up on me almost every day, and I think that's really important. I've read a lot of personal accounts of people who've not got that support system. And if you don't have that, I really recommend asking your surgical or your medical team about a therapist. Even just talking about it, expressing your fears and your concerns, just voicing it sometimes instead of keeping it in can help, because this process isn't straightforward. It's not something that you know what the outcome is going to be. So take the time to really digest what you're doing, why you're doing it, make sure that you really understand why you're doing this, and make that a part of who you are now. This is a part of who I am. This is a part of my journey, and it's nothing to be ashamed of. Some people have mentioned that they feel like they've lost their femininity. I can't relate to that because I don't honestly feel that way. I think, if anything, this has almost given me a bit more confidence, because it's made me realize that something we put so much weight on for women to find themselves beautiful or worthy, the size of their breast, it's lost its meaning to me. My husband still finds me attractive. I still find me attractive. I did this for a reason, and that reason was for me, for my long-term health. I didn't do this for anyone else. I didn't do this for anyone's approval. And if anybody's going to go out there and judge you for the scars that you have or what you've been through, they're not someone you need in your life anyway. I really believe that. And if someone's going to go out and judge you because you have scars, well, that's on them. You don't need to put their opinion on yourself. So just wanted to say that, because it makes me feel kind of sad for people who are going through mastectomy with cancer or mastectomy pre-cancer, that there would be people out there judging you for something you may or may not have control over. So that's the end of this section, which is the post-mastectomy. As I mentioned before, I did just have my second surgery, which was the expander to permanent silicone implants 3 days ago. So I will be doing another video about kind of how that surgery went. So stay tuned for part 4.